The Delta variant now accounts for more than 93% of all coronavirus cases here in the U.S. Infections have been on the rise since June. The nation recorded.
Hello, today I present to you an extremely attractive application for music lovers. It's completely free. You can listen to music online or download unlimited music to use whenever you don't have internet. The powerful search function helps you find anything you want. Trust me. It's hard not to find what you're looking for because the search function is really powerful. Application download link is attached in the description of the video. I'm pretty sure you'll like it. Thanks.
More than 103,000 new cases on Tuesday alone. And Dr. Anthony Fauci says the U.S. could face a, quote, smoldering infection if more people don't get vaccinated. Meanwhile, 5 states are expected to hit record high hospitalizations in the coming weeks. Florida is one of them. Manuel Bojorquez is there with more on the worsening outbreak.
Florida is setting a pandemic record with more than 12,000 currently hospitalized with COVID-19. The patients are younger, too, with half between the ages of 25 and 55. 91% of COVID patients in this hospital are unvaccinated.
I'd imagine when a vaccine started to roll out, you thought that this would be a preventable thing.
Correct, and it has not. And that is what's causing the spread of the virus.
Florida Governor Ron DeSantis blamed the media.
You try to fearmonger, you try to do this stuff. And when they'll talk about hospitalizations, our hospitals are open for business.
They are, but they're strained. Memorial Healthcare plans to put off elective procedures to care for COVID patients. The hospital system is also adding an overflow unit of 266 beds just to handle other patients.
Do you see the numbers going down anytime soon?
No, I don't see the numbers going down.
Why is that?
It's just keep increasing, and you thought we would have been okay last week, and this week is even higher. I don't see it.
Florida and Texas lead the nation in new cases. Their governors have pushed back against restrictions, calling them ineffective intrusions.
But you aren't going to help at least get out of the way of the people who are trying to do the right thing.
Republican Governor Asa Hutchinson of Arkansas says he now regrets outlawing mask mandates for schools.
Everything has changed now. And yes, in hindsight, I wish that had not become law.
Dozens spoke against a proposed mask mandate in St. Louis.
100% of the people that get COVID in St. Louis County survive. Why would we mandate a cover for our faces?
But a new poll finds 53% of unvaccinated adults believe the vaccine is a bigger risk than COVID itself, which is not supported by any evidence. 28-year-old Tevin Figueroa is among the vaccine hesitant.
Is there a reason why?
No, just some personal. This still happened. I'm not too sure. And I keep on seeing like side effects.
For some, the fact the vaccines have only been approved for emergency use so far has been a sticking point. But the FDA has signaled the Pfizer vaccine could receive full approval by the end of the month. Lana?
Manny, thank you. For more, let's bring in Dr. Elizabeth Clayborne. She's an adjunct assistant professor of emergency medicine at the University of Maryland School of Medicine. Dr. Clayborne, what do you make of this idea of a smoldering infection that will prevent us from getting back to normal? Do you believe that enough people are now getting vaccinated in order to prevent this? What are you seeing on the front lines?
I certainly think that that is a very real threat that will have an ongoing kind of concern for COVID that will stretch several months from now and never fully resolve or reach this quote unquote herd immunity because we will not get our vaccination percentage high enough to provide protection and kind of stomp out COVID altogether. Currently, what we see in Maryland, a state that I must say is actually doing very well compared to other places in the country, we have one of the lowest case positivity rates and one of the highest vaccination rates. I still have seen in the last couple of weeks an uptick in COVID positive patients. And our hospitals are therefore now preparing again for a potential surge and all the pressures that that puts on not just the emergency department where I work, but all parts of the hospital that get stressed when we have an influx of sick patients.
Well, Dr. Fauci says that the, quote, horse is out of the barn when it comes to the Delta variant. The more contagious strain is in more than 112 countries now across the world. And it also makes up more than 93% of the cases that are circulating here in the U.S. Remind us what we know about this variant as people are still weighing whether or not to get vaccinated.
Lana, I think that that's an important point to bring up. The COVID risk right now is more severe than it was when we first dealt with this pandemic early last year. The Delta variant we know is more contagious, potentially more virulent, and potentially is resistant to some of the therapies that we offer, such as monoclonal antibody therapy. All these things point to the fact that if you are not vaccinated now, you're taking an even greater risk than those who were not vaccinated last year, because the Delta variant is that much more dangerous. And I also would like to point out that while we are having so many people who remain vaccine hesitant, we are increasing the risk for an additional variant to spin off, either in a country outside of the United States or within the United States, that could penetrate our current vaccines more so than they do now, or potentially target a population such as children who are still very vulnerable because they remain unvaccinated. So all this is to say is that it's very dangerous times. And I encourage everyone who is vaccine hesitant to really re-examine what information they are making that decision based on, and to validate the source. As a physician, I always make sure that people know that I look at the actual data, the peer-reviewed medical journals, and understand that this vaccine was approved based on data that shows that it is indeed safe to take, and certainly less risky than taking your chances getting COVID, especially now with Delta circulating so widespread.
So Dr. Clayborne, let's talk about that a little bit more, because as you heard from Manny's reporting, people who are not vaccinated are actually more concerned about their health with the vaccine than they are with their health and possibly contracting the Delta variant. And a poll from the Kaiser Family Foundation found that unvaccinated adults who say they definitely won't get vaccinated are more concerned about vaccine safety and effectiveness than they are about the Delta variant. The poll also found that 3/4 of unvaccinated adults are not worried about getting seriously sick. Are they wrong?
I'll tell you anecdotally that every patient that I've either had to admit to the ICU, or the families of patients that have had breathing tubes placed, none of them were ones that said, you know, I definitely think I'm going to get sick. They all said the same thing. I didn't really think it was that big of a deal, or I, didn't take my time to go get vaccinated because I thought that the threat was under control, or I was worried about what would happen if I did get vaccinated. None of them plan to have the complications associated with COVID, which is indeed life-threatening. And so I do think that this population that is hesitant, I don't want to downplay their fears. I just want people to ask the right questions so they can get the appropriate information. And right now, all the data is showing us is that these vaccines are very safe. For the population that remains hesitant, that same Kaiser poll did show that a number of those people might be more willing to vaccinate after we get full approval of the Pfizer's vaccine, which we expect to get before Labor Day. And I hope that after people see the rigorous review of all the information about these vaccines, when that is complete and it has a full approval, I hope that that helps people bring their confidence up so that they can get on board and get their jab and hopefully protect not just themselves, but the community around them and those who have yet to be vaccinated because it's not yet approved for them.
I think that's a very important point there. I appreciate you sharing the context of what you're seeing from your patients, because of course nobody expects that they're going to be the person who gets seriously ill. The World Health Organization is calling for a moratorium on booster shots until at least the end of September. Why is that?
Well, people have to remember that we live in a privileged bubble, really, in the United States. I sometimes always bring up that we kind of are squandering our opportunity of privilege of having access to all these vaccines that's readily accessible in most places for people who want it. The rest of the world is scrambling to get enough vaccinations to pass the 10% threshold, which is what the World Health Organization is hoping most countries can surpass by the end of this year. And right now, they don't have the resources or the actual vaccines they need to get to those numbers. And so there are certain places in the world where COVID is just spreading rampantly because they don't have the vaccines that they need. And so I think that the World Health Organization is hoping that developed countries and countries that have a surplus or excess of vaccinations right now will continue to share some of their resources with other more resource-poor countries and potentially delay doing booster shots until we know it's essential, so that we can let other countries catch up and reach some degree of safety and protection that we've been enjoying for several months here in the United States.
Just to follow up with you on this point a little bit more, there are some countries, including Israel, that are already giving out these extra doses. Given what we know about the virus and the Delta variant, do you believe that booster shots will become necessary in the future?
A lot of people continue to ask this question, and technically the CDC guidance has not come out to officially decide whether we will need a booster or not. But the current evidence is pointing that yes, we will probably need a booster shot. It is possible that COVID could become an endemic, meaning similar to influenza, where it does not ever go away. And that kind of harpens back to this idea of it being a smoldering infection that will always go on and that we'll always have to protect ourselves from. And that's more likely to be the case if people don't kind of jump on board and get vaccinated right now. As someone who was vaccinated in the very first round of people, I completed my series in early January. I certainly am eagerly awaiting what the guidance is going to be as far as needing a booster, since I work in a high-risk environment. But I am waiting to see when the data shows that is going to be necessary. And I believe that everyone is looking into that same question and doing the diligent research that is needed to make sure that we're protecting our population, but also being mindful of how we utilize our resources here in the U.S. and abroad.
It's, I'm sure, especially difficult seeing so many doses of vaccine expiring and being thrown away when there are across the world so many people who are clamoring to get it. Let's talk about children for a little bit. On Tuesday, we reported nearly 72,000 children and teens tested positive for the virus last week. That's a big jump from the 39,000 cases just a week before. Why are we seeing this surge in younger Americans, and what implications does this have as schools are gearing back up for a new academic year?
Yeah, I think a lot of parents and just Americans in general should be very worried about what could happen with the case positivity rate in our pediatric population. Currently, they're one of the most vulnerable populations because they do not have an approved vaccine and have not been vaccinated under the age of 12. I believe that a lot of the jump in the positivity rate in this population is due to Delta because it is so contagious. It is probably being more easily transmitted to children, potentially even by people who are vaccinated, and then they're becoming symptomatic because they haven't had a shot. I want to keep everyone, again, mindful that this is all the more reason why, if you're eligible to vaccinate, you should. There is nothing preventing this virus from potentially mutating into something that could start being more harmful and more dangerous to children. And right now, in general, pediatric populations have done reasonably well as far as symptomatic COVID, but that may not remain to be the case. And as we enter the school year with a lot of schools going back into in-person sessions, this risk will be even greater. And so there certainly needs to be some mitigating factors with masking and protecting our kids as much as we can until the vaccine is approved for them.
Dr. Elizabeth Clayborne, thank you so much for coming on the show, and thank you for all that you do.
Thank you.